On this episode of Africa Health Check,
serikali inajitahidi kuhakikisha kwamba mazingira yako safi, vituo vya afya viko vingi.
The government and us, a community, should work together to ensure better health provision.
we explore the importance of community involvement in effectively addressing and mitigating the impact of pandemics such as COVID-19.
Africa's transformation agenda are communities and the pivotal role they play in achieving sustainable development. On today's episode, we will be discussing community engagement in response to pandemics. I am your host, Morokozo, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Moreithi, the current chair of the Department of Medical Microbiology and Immunology, and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from our panelists, let us have a look at this episode's feature story.
I currently work for the Ghana Health Service as Quality Lead and Deputy Director here at the Institutional Care Division. I think one of the key lessons that we learned in the COVID response is that whether we'll be able to break transmission or not depends on community action. It depends a lot on community action. So the first thing is that the trust between the communities and health systems was very, very important. I call it social capital. What is the community willing to do to make sure that the greater good comes to fore? And we saw this in the beginning when there was a lot of misinformation, which is a reflection of what trust communities have for us. A lot of innovations came out from communities themselves. Talking about various technologies for hand hygiene, production of local soap and hand sanitizers. All these have been innovative ideas that came from the communities. In mobilizing community action using traditional healers and faith healers, if these people did not mobilize the communities, we would not have been able to combat the pandemic. So we have learned from the pandemic that we cannot actually have a pandemic response without communities. We also have some specific intentional programs to make sure that the voice of the patients are at the center of care. For instance, we introduced a program called the Community Scorecard. This is a situation where on quarterly basis, communities come together. They assess the healthcare facilities using an indicator set of 9 indicators. They identify the gaps that are present and they draw an action plan. The community folks also go ahead to mobilize resources to be able to implement the decisions or recommendations that they make in these action plans. And they do this in the absence of the healthcare worker to avoid intimidation. I have the understanding that communities are at the core of what we do, not as people who are receiving health service delivery, but actually as people who partner us to make sure that health systems are performing and are resilient. And communities do this by co-designing interventions with us. They also do this by actual implementation of the interventions. And they also do this through the monitoring and evaluation of our interventions. In our efforts to make sure that health systems are very responsive, we usually know that patients, communities, and their families are at the core of what we do. So in healthcare quality, likewise, we try to make sure that we are designing and implementing programs that make sure services meet the standards of the healthcare system, but are also satisfactory to our patients. So that means that without communities, actually, we do not have health systems. So we can do a lot of investment in the health system, but if the patients, their families, and communities do not trust us, we will not be able to get the response that we need. In terms of health information, it means that we also have to constantly make sure that information is available to our communities when they need them, and in a manner that they would understand the information that is made available to them. And this also means that when it comes to funding of health interventions, communities should also be engaged in the mobilization of resources for health system strengthening. So imagine that if you were a community, how would you want decisions around your service delivery or around your healthcare services to be made? You would like to be brought to the table, you would like your voices to be heard, and it is the same thing that our communities expect from us. So don't plan anything for the communities without the communities.
Don't plan anything for the communities without the communities. Such a very profound and powerful statement. Maybe now to come to our panelists, and starting with you, Reverend, why is it very important that communities are involved, and not just involved, but meaningfully involved in responding to public health emergencies?
Yeah, because people are born into communities. They are raised in communities. And most importantly, Africans in general, we live in communities. We are community-minded. That is why you can't bypass them to enforce anything. You can't push anything on them. If one rejects you, chances are the rest will reject you. But if one accepts you, you have a high chance of being accepted by the community.
Yes, and what are some of the key roles that they play during such pandemics or public health emergencies, initiatives around healthcare? Maybe you can also share examples, Dr. Marianne?
Yes, communities are very important. These diseases actually circulate within the community, they affect the community. And I like what she's just concluded by saying, you cannot plan for the community without the community being there. And I think we use this slogan everywhere. You can't plan a woman's intervention without having a woman on the table.
And the young people.
African on the table.
That's for youth without you.
You know? Yeah, and I like that approach that we're now adopting, that we cannot plan for a community without having a community or the community itself represented in there. And we need to work in unison. And we saw the fantastic response that the African communities, the way we came up, responded to COVID-19. I think we set a pace for the whole world to watch and see how to respond to an outbreak, to a pandemic, because we listened. We listened to the voices, and then we responded very quickly. We were educated that, hey, you have to wear masks, and you're wearing masks because of 1, 2, 3 things. We need to cut the roots of transmission. And people quickly adopted that. Resistance was very low from where I come from. And we could walk around the streets and see people wearing masks. And that was fantastic. The other intervention, wash your hands. And people quickly started even building innovative basins that had a foot pedal, basins that were children-friendly. They're little basins that were also disabled people friendly as well. So again, as a community, we responded well because we listened, we worked together, because we knew if we work together, we'll cut these roots of transmission, we'll cut COVID-19 within our communities, and we'll have a better outcome, all of us together. Ubuntuism, I think that's a word.
Pan-Africanism, essentially.
Exactly. Yes.
I think one of the things that is fundamental to community engagement or working together in response to public health emergencies is the issue of trust, and building unity and overcoming, the lack of confidence that sometimes our communities have, the hesitancy that often we see our communities having when new interventions are introduced, or there's so much information that we don't understand. So, Reverend, as a community leader, perhaps you could weigh in on what is it that public health or medical practitioners could do to build that trust with communities as they work with them in responding to public health matters?
Yes. To me, that is what I was trying to understand, the concept of community in this. We can talk about global community, we can talk about tribal community, but it goes beyond that.
Yes.
any group of people that are bound by common interests, a common belief, common challenge, we can call it community. So you can talk about medical community, you can talk about church or faith community. Yes. So to your question, it is one, identifying with each other around something that becomes a community. And where there is acceptance, where there is trust, where there is patience for one another, where there is care for one another, that becomes a community. And if anyone is coming from outside, these are the pillars that the people will look up to for acceptance. Do you believe in what we believe? Do you share what we share? And if that is defined, that becomes the community. Right.
Absolutely, absolutely. Dr. Mary Ann, what would you say are the fundamental lessons that we've learned from past pandemics, including COVID-19, around the importance of community engagement in the response?
Yes, so one lesson we learned is, can I start with trust? We have to trust each other, trust the voice that's coming to address us and tell us about this a problem, and we need to face it together. And not just COVID-19. I think where we sit in sub-Saharan Africa, we are exposed to several outbreaks, pandemics, epidemics, HIV, and Ebola, Lassa fever in West Africa, so many. And we have really risen to all these different challenges. How have we risen through that? It's through that community networking, through listening to that common voice, trusting that, hey, this is for our common good. So in case there's a fever, in case there's an outbreak, who are we reporting to? Who are we talking to? And how are we responding to it? We have become very good at that. And I've seen international papers actually looking at the model. How did Africa succeed in the COVID-19 pandemic where other communities did not? And again, it was down to the unity we have, the trust we have within our communities, having community gatekeepers, community leaders, people who, there's a layer within the community. And then there's that Ubuntuism. We want to protect each other. I want to protect my neighbor. I don't want my neighbor suffering. And I hope that spirit will continue being fostered within our community. But allow me to give you an interesting perspective as well, an example. A few years ago, there was a rollout of the tetanus vaccine to be given to pregnant women, so that when they're going to give birth, the child will be protected against tetanus, because there's a lot of body fluid exchange, etc. But the way it was rolled out, can I say, almost like by force. All pregnant women, you'll be forced, not forced, you have to take the tetanus vaccine, and this will save your lives and save your children's lives. But without explaining how is it going to save. And there was so much resistance. The community, led by the church leaders, they're like, no, pregnant women, stay put, because the way it's been sold to you by the different ministries, there's something sinister. And then now they started this conspiracy, or they want to curb our fertility, or they want, and I sat back just to watch even the debate on TV, because they invited the Minister of Health and a faith leader, and he ended up being the one being defensive. And I thought, no, this is a platform now, the national platform you have to win the public and the community trust. Come in there with your science, talk about what tetanus is and how it's going to save your baby. You want a baby that is thriving, not a baby who has all these comorbidities, infections, has a prolonged stay. But the church leader was the one who carried the day, which is great also. But I really thought our scientific community, we need to win the trust of our community.
Absolutely.
Don't just come and sell an idea and think it will be taken very quickly. I wish the approach our government or the ministry took was engage the church leader. Look, this is a problem. and then work as a team.
Yes.
Yeah, and then now go to
And
the
also
community.
understanding the colonial history in Africa.
Yes.
We do understand why there's so much hesitancy when it comes to accepting certain narratives,
Yes.
Western, or being pushed down an agenda that is being pushed by some multilateral agencies, anti-African agenda and so on and so forth. So I think this is where now that misinformation has to be overcome by building that trust with the communities. And speaking of the approach, I think it's one of the key things, the approach that is being used to ensure that it's culturally sensitive, socially sensitive, and contextually aligned. And I wanted to ask if maybe
vehicles of communication.
Yes.
That they will understand.
Yeah.
So you bring it down to their level so they can appreciate in real terms.
Don't use jargons, don't use big words.
Yes.
Break it down, use illustrations. Africa is a storytelling communities.
Indeed,
so find ways to communicate those messages to them. In fact, even at church, sometimes if you're very careful about the messages that you preach to your audience, you are always audience oriented. There are different audiences, and it depends at their level. Sometimes I tell people, I've studied English, I've done postgraduate program. I can speak English at different levels, depending on which audience. So it is with.
Absolutely. I want us to talk about now ensuring that community engagement or participation is also inclusive, because we know that that's also another area where only the elite, only the ones who are maybe conversant in the English language, as you're saying, have the opportunity to actually engage in those activities, initiatives. But how do we ensure that we leave no one behind? When we're actually talking about community engagement, we mean everybody in the community having an equitable opportunity to be a driver of change, an agent of change, and contribute to the healthcare response.
Are very vibrant. We are ready to work and give back to our communities, and we are educated. We have a lot of ideas to give, so we deserve to be given a chance.
COVID-19 was a changer. It was a disruptor. It disrupted us in very many ways. In terms of our daily lives, for us that work in office, we began to actually understand that we don't have to be in office 100% as one of the things.
The current health in Africa, I think, is still challenging because, you see, our people, to some extent, they are not tidy or hygienic enough in their doings when they do things, when they litter the streets with all their, left out.
How do we ensure that we promote inclusive community engagement or community participation when it comes to responding to public health emergencies and other health matters? Perhaps you could also share some great initiatives where the community was included, including vulnerable populations within that group. Should we start with you, Reverend?
Okay, yes. I would suggest that you look at the profile of the people you are dealing with and bring yourself to their level. For instance, they are illiterate. You are a scholar, you speak English, you speak French and everything. You don't get an interpreter. Give or get someone among the people and tell the person whatever you want to, and they will translate it in the language that they can understand.
Yes.
So if you want to get anything done, use one of those illiterate people to do the speaking or to do the communicating, and the people will accept.
Yes. All right. You want to add on to that, Dr. May?
Yeah.
How do we include the vulnerable populations? And, usually when we're talking about this, we know that there are many initiatives about involving communities and initiatives, consulting with them to hear their views on health policies, but you also need to have the capacity to be able to constructively engage. And often we find that young people, women, people in rural, remote areas don't get an equitable opportunity to to actually be meaningfully involved in those responses. So how do we mitigate that?
Yes, so I can give you a few examples, particularly that revolve around COVID-19. I saw really great initiatives in the villages where the governor, that's the head of these different counties within Kenya, would gather the women. And the women would be given the sewing machines and then taught how to make masks, taught how to make PPEs for the nurses, the doctors, and the healthcare providers. And there was so much joy in these women in that they are contributing to the COVID-19 response.
Yes.
Another great example was in season 1, where we saw of Africa Health Check, where we saw someone from Nigeria working closely with the prisoners in responding to COVID-19. Again, that was so inclusive in that the prisoners felt a part of the community in terms of the response. I've seen in primary schools, these are young little children being taught how to wash hands. And then these children coming home and teaching mom and dad and the people at home, even the grandma, grandpa, this is how we wash hands. For me, that is community engagement. That is so inclusive because you're involving both women, children, prisoners, and many others. Allow me also to add visual aids. I walked around Kibera at some point, and they had all this fantastic artwork.
Yes.
So even if you can't read, if you're deaf or you have some
you're not literate.
Yes, that's the word, not literate. But you can, I need to wear a mask because you can see the entire story of protecting yourself, not just against COVID-19, but I've seen fantastic artwork that helps people be more accountable in their sexual and reproductive health. I'm very passionate about that, and many others. So we have the tools. We have the capability as a community. If you want to reach teenagers, social media is there. There's TikTok. But in that TikTok, you can create a very positive message that will reach the age audience that you want. And I feel for me that is quite inclusive. So it's not elitist, the message you're trying to give, but I always say, we can do better.
Absolutely. I think one of the things you want to just chip in?
Yeah, so what I'm getting from Dr. Marian is bring yourself to their level. Bring yourself to their level. So once they get it, they'll be able to communicate.
Absolutely, absolutely. I also wanted to pick up something that you said, Dr. Marian, the importance of involving the media. Have you noticed that many times when we talk about community engagement, raising awareness, public education, we never actually specifically define the very important and pivotal role that the media plays as a key stakeholder, as a champion, as a driver of change. We say in the media world that media is the most powerful tool simply because it reaches the masses.
But it says the fourth arm of government.
Exactly. Where you cannot reach by car, by speaking, by what, even in the most remote communities, you find that usually they have a radio, or any form of media, So I think we also need to emphasize that when we're talking about community engagement, we also need to have the media, not just as those who will report on what is happening, but how do we strategically engage with them to sort of channel the messaging. So as we wind down the show, I just wanted you to just give your final parting shot around recommendations on community engagement regarding control and preventative measures. Reverend?
I think that when anything happens, people should be quick to report. This is something like, disease, how to call it, surveillance and things like report to people among you. If you don't know what is going on, you don't understand what is going on. And when explanation has been sought, you disseminate this to your, it's just communicating, just letting other people know so they can come on board. I think that is pivotal in building community towards a particular issue.
Absolutely. Dr. Marian, your recommendations around community engagement regarding control and preventative strategy.
For me, I would just say, let's be our brothers' keepers, our sisters' keepers. let's watch out for each other. As a Reverend has said, in terms of even within the community, strengthen the surveillance, strengthen disease detection, strengthen, as we even watched, the health systems, that everyone can access both information, medical services very quickly at the tip of their fingers. And that calls for communities to work together in unison, and also communities to work together with government, communities to work together with NGOs, and with that we'll have very thriving communities. I'm very passionate about having a thriving community. The youth engaging in meaningful and economic engagements. The women can seek health services very quickly. Our children are going to school without having to shut down schools because of an outbreak. But that involves the community working together. And maybe just as our feature story was saying, working together, but as partners, not just beneficiaries, not just as spectators, but actually as strategic partners. Yes. And I was just going to say, as a parting shot, there's a saying in my local language, Kikuyu, but I'll say it in English: you cannot shave the back of your head. You need someone to do that for you. And wonderful. Really, we need each other. Yes, absolutely. Wonderful. And that brings us to the end of today's episode. But before we wrap up, I'd like to take this moment to take us to Ethiopia, where we highlight our African health champion for this episode. Have a look.
On this episode, we step into the transformative world of COSAP, the consortium of self-help approach promoters, as they strive to create healthier communities in Ethiopia. One of the exceptional initiatives revolves around empowering young female leaders. These extraordinary individuals are equipped with knowledge about vaccinations, communication skills, and community mobilization techniques. Taking charge, they share their newfound wisdom and engage with their communities, touching the lives of an astounding 432,000 community members. They work tirelessly with healthcare professionals, creating an atmosphere of inclusion and understanding. With their unwavering dedication, they are creating a lasting impact on healthcare and community well-being in Ethiopia.
Really inspiring story from Ethiopia, from our comrades there. Keep up the excellent work. And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, Instagram, and the handle is @Africa Health Check. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.